the tobacco tax is something, it has been an issue that I have been going on about for some time. It seems pretty logical to me that because cigarettes have gotten way too high, normally law abiding citizens have been forced to turn to illegal products. Why is that such a hard concept to grasp?
Look, I think for a lot of us, Rob, it's not a hard concept to grasp, but I think there's so much sunk cost in this for government, and governments of both political persuasions have been pursuing this for quite some time. And backed in by the public health advocates, the tobacco control advocates, who have been very successful over the years. But we're in an entirely different situation now. And I think that, the common refrain that we hear from the people at the peak of tobacco control advocacy is now the illicit market is so sticky that no matter what we do, no matter how far we bring down the excise, there will always be an illicit market. But just to unpack that, no one's saying that bringing down the excise is going to completely get rid of the illicit market. What we'd love to do is get the illicit market down from where it is now, which is somewhere between 60 and 80%.
Well, this is the key, right? Because it seems obvious to me that the high taxes have led people. I know people personally who buy illegal cigarettes because they just cannot afford to maintain their smoking habits. And so there's been lots of good things the government has done to bring down cigarette use. But last week, they released a report saying daily smoking rates among people aged over 18 years or more have fallen to a historic low of 5.8%, well below the government's 2025 target of 10%. Now, so, Nick, that represents 500,000 fewer daily smokers than 3 years ago. Is that report believable?
Look, as I said in the press club yesterday, as a student of public health myself, I think every survey that you have has some degree of believability. But I mean, the government acted as though that was the only survey. And Rob, I don't know how many of your viewers have been down to Victoria, but there's a great little institution down there called the National Gallery of Victoria. And it's not a national gallery at all. And this is a similar sort of thing. This is the National Drug Strategy Household Survey. And it's just because it's got the word national in it that everybody assumes that it's the correct number. But I think that most Australians have seen other numbers. They've seen nicotine in wastewater being at record highs. They've seen numbers closer to 10% in Western Australia, 9.3% in New South Wales. So I think what really people were owed was a curious and credible explanation as to why this was the first survey that has really showed that quite remarkable decrease. Now, if the number's correct, and it is 5.6%, that's fabulous. But the majority of those smokers are purchasing from illicit sources.
So this is the thing I'm trying to understand. If they're basing it off official sales, then of course the numbers have come down because people are turning. We know there is a booming illegal trade of cigarettes. So if people are turning to these illegal cigarettes, then of course the official numbers are coming down.
Well, I mean, I think the other way to think about it, Rob, as well, is that in an illicit market, is a person who participates in this survey going to respond the same way as they would have done 3 or 6 years ago? And the answer is probably no. They're probably not. You're going to get.
But why is that, Nick?
Well, because suddenly people would be forced to admit that they were doing something illicit.
Gotcha.
And when you're asking people that in a survey, in fact, there is a disclaimer on that very survey that says there might be underreporting because of illicit use. Now, that was always in terms of heroin or cocaine or ecstasy, but now that applies to tobacco. And it applies to tobacco precisely because it's illicit now, and people perhaps don't want to respond in the way they used to. So there's a lot of reasons why we should welcome the survey, but there's plenty of reasons why we should be cautious about what it means.
Look, one of the things that continually blows my mind is the way the government refuses to accept the basic idea that higher prices are forcing people to look for cheaper alternatives. I want to take you back to late last year. Have a look at this exchange between Malcolm Roberts and Murray Watt in Senate estimates and see. Have a look at what happened.
Minister, do you consider the government's very high tobacco duty is the reason otherwise law-abiding citizens are prepared to buy illegal tobacco for generally a third of the legal price?
No.
Any reasons?
There's absolutely no evidence to suggest that argument.
You're joking.
No.
Okay.
Now, what's interesting about that, Nick, is that a week before that exchange, a paper was released by the Centre for Independent Studies outlining how the tobacco tax had led to, you guessed it, illegal trading. Why is the Albanese government refusing to believe the evidence?
I mean, that's just extraordinary comments from Murray Watt, and just shows you what a politician's there to do, just deny and obfuscate and not sort of tell the truth. That's not what we want from our politicians.
It's a lie. Can we call it what it is? Because anyone would have to accept that higher prices are forcing people to go to illegal sources.
Yeah, it's a deliberate. I mean, it is a deliberate mistruth. Absolutely, we can call it what it is. Yeah, I mean, you're sitting there and getting something very reasonable posed to you, and you're saying the exact opposite.
Okay, we've talked about the issue. We know that the excise is the problem, but are there any other solutions? What can we do?
Well, with something that's so difficult, Rob, you've got to do as many things as you possibly can. The problem with this government is that they think that they can law enforce their way out of this. Now, any student of history will look back to the 1930s and the prohibition of alcohol and realise that it just doesn't happen. I mean, we haven't been able to stop record amounts of cocaine coming into this country, and now we have a nicotine illicit market that's bigger than every other illicit drug combined. So if we can't stop the markets for heroin, cocaine and ecstasy, then how are we supposed to stop the market for illicit tobacco with law enforcement alone? So you have to bring the excise down. You have to do law enforcement. Nobody's suggesting you shouldn't. And then you also have to bring people who are smoking onto less harmful alternatives like non-combustible nicotine products and therapeutic vapes.
While I've got you here, can I ask you a couple of other questions? Because the ABC has unearthed a Malcolm Roberts claim from a few years ago where the One Nation senator was open to the idea that COVID-19 vaccines caused miscarriages. What do you make of those comments?
Well, I didn't see exactly what Malcolm Roberts said. I know he's had some significant concerns about vaccine. You know, Rob, I always want to see what the exact quote was. I remember
think that's
when
wise.
You know, when Donald Trump was suggesting that people inject detergent for COVID-19, in fact, his exact quote was, "Wouldn't it be good if we had something like detergent that you could just inject into people's veins?" That was the quote, and the media ran off with it in a certain direction. So that's the first thing to say. But, you know, there were significant concerns about the vaccine amongst pregnant women. They're concerns that I tried to allay the fears of. I don't think that there's any evidence out there that pregnant women should not get the COVID-19 vaccine, or certainly shouldn't have done back then. But, I mean, he was raising concerns that were shared by a reasonable number of people in the population. And depending on how he did it, I guess that is his right and role as a politician.
Do you think the narrative about COVID has changed? You know, I was working at 4BC at the time, and it was pretty clear that we had to get on board with the COVID messaging, you know, and people in public had to do that. And it felt like we weren't really allowed to question it. You know, it was almost like we had to be good soldiers and do our bit for the nation. And do you think things have changed since then, where people are now questioning what we gave up during COVID?
Yeah, I think there are a growing number. I think that if you did a survey, maybe another national household survey, Rob, you'd probably find still a majority of people supported, but it's eroding, and it's certainly not the massive majorities of support that we used to enjoy, I think.
Now, you actually issued an apology for the part you played during the pandemic. What were you apologising for?
Yeah, I did. I mean, I got a lot of, I guess, feedback. There were a couple of things in particular about the vaccine mandates, Rob. So I think the fact that we had sort of claimed that we were that people had some sort of choice, when in fact we were telling people that they couldn't move around without a vaccine, they couldn't be have their jobs without a vaccine. I had people contact me who had lost their jobs of 10, 15 years because they were, not willing to take the vaccine. And it did sort of change my mind at the end of 2021 to say, well, but and I said this on Mark Boris's podcast, Straight Talk, which came out today. I think it's entirely possible, because there was that Team Australia approach and people were working together, we probably could have achieved high vaccination rates without the mandates. But I think, there was a lot of distress caused by a lot of people, and for a lot of people, I should say, a lot of distress caused by those mandates. And I think, we seem to say sorry for a lot of things in this country. Rob, I think to me it was just a logical one to add to that list.
Have you had pushback against your apology?
Yeah, I mean, you should get on Instagram, get on Facebook. I mean, there's still people who are very angry and upset out there. I think mainly it's pushback from people who say the apology is not enough, too little, too late. You had your part in it. I accept people hold those strong views. I haven't had any pushback. Isn't it something
that you're looking back and saying, look, I've had time to reflect, and I see things that I would have done differently? Surely that's got to mean something.
I think it means something to a lot of people, and there's not quite an equal number of people on social media who come out and say exactly that, but there are people who do sort of express their thanks, and in those terms. I don't know what no one from what I would call maybe traditional establishment public health, if I'm swimming against the tide here, I haven't had any negative pushback from colleagues who say perhaps haven't chosen to take the same apology sort of stance as I have. So, but I'd love to sit down with them and see where their head's at on that. And I'd love a Royal Commission. I was opposed to it before, but I think
why were you opposed to it then, and why are you for it now?
I think it would have been too politicised, and it will still be politicised. All Royal Commissions are, but I think with the tincture of time, people can adopt a bit more of a dispassionate view. And there's some big things that we need to sort out. It's not just the mandates. It was the vaccine procurement. It was what do we do with state borders. It was all those sort of things that really have never had an airing. And if they've never had an airing, I mean, we had a Royal Commission, and it was obviously tragic losing the lives of the Sparkies in the Pink Bat saga, but it was, in terms of orders of magnitude, that was several orders of magnitude less by a long shot than what happened with COVID. So we've had Royal Commissions for far less, and this would be probably the biggest thing that we've never had a Royal Commission for. So I think after the Building Royal Commission, I think, is when we should do it. There needs to be a Building Royal Commission into the CFMEU first.
You know what's interesting? You mentioned borders. Living up here in Queensland, we actually liked having a border because we could go out. We could,
Yep.
I remember there was one weekend, it was my daughter's birthday, my youngest daughter, and we were in a park, a group setting, and I literally sat there and had a thought about people in Sydney and especially Melbourne, where they were in lockdown. And I remember thinking how lucky we are. And then I also would get annoyed at Sydney presenters, Ray Hadley, Samantha Armitage, who would demand that Queensland open their border. And I'm like, you want us to open the border so we'll let COVID in. In hindsight, what was, do you think, the right way to go?
Look, I mean, Queenslanders, West Australians, like they were protected, but protected from what and for how long? They needed protection. We all needed protection very early on. But the reality was that there were only a very small number of cases in 2020. And by the time we got to 2021, mid-2021, Rob, we were largely vaccinated. We largely had our at-risk population, which was, adults certainly over the age of 70, and then perhaps 60 and 50-year-olds, they were at risk as well. But when you got down into the, having to vaccinate every adult to the point of 95% before you could get people across the borders, I just don't think that was in line with what we knew about the condition in 2021. So we could have opened a lot earlier, and I think we've got to remember how much fear there was in the community. But remember when that fear dissipated? It was when Omicron.
My theory, Nick, on that is that I feel like most people thought it was like their World War II. We do our bit for the nation. We all come together, and then people got over it, and they didn't want to borrow it.
Yeah, but why do people get over it in that situation, Rob? Why do people get over the unknown and uncertainty? Because it becomes known and it becomes certain. And when we looked around the world, yes, there were tragic first waves in a lot of nations in Europe, but the reason they moved on is because they had their first wave. Now, I did not want that for Australia. I still would make the same decisions now about international border closures and that sort of thing. But fear is there when we don't know what is going to happen to us, and there is nothing more. It doesn't engender fear as much as an infectious disease pathogen. You can't see it. You can't see when it's in you, and you don't know what it does to you. But by the time we did work that out, which was at the end of 2021, I think everybody, it sort of, went through like a huge wave, Omicron, exactly the same size as the first waves in Europe, I might add, which is, what we would expect. But we were all vaccinated, and really then the number of deaths, although high, it was restricted to people who were very much at the end of their lives in nursing homes around Australia. Still deaths nonetheless, but a markedly different situation than if it had gone through in 2020. So you can see that there's still balance and nuance to the discussion, and you can't say, Palaszczuk should never have closed the borders. But you can say she might have taken a bit more of a compassionate approach to people living in Lismore and Byron and places like that.
Yeah. And it was an election winner for her. Hey, before we go, we haven't discussed the biggest issue that's going on in Australia at the moment. The names being mentioned to replace Carl Stefanovic on the Today Show. There's lots of names going around. Yours is one of them. Have you heard anything? Has there been any talks with the network?
Well, there was one person who raised my name, Rob, and that was you. And I'm very, very grateful for it. Despite you raising my name, I didn't get any odds on Sportsbet. And in fact, even Paul Gallen has 100-1 odds, and I'm not even listed. I'm not even a roughie on Sportsbet. So, yes, I want to tell your viewers, I am disappointed. I'm embittered, and I look forward to the call from the head of news tomorrow.